This pandemic impacts all of us, and many of the regular touch points in our lives have been removed or drastically changed. Dr. Hinshaw keeps reminding us that we're in this together. For most of us, this means practicing physical distancing, and for many of us, working from home. But for caregivers, their work does not stop. They carry the great responsibility of being entrusted with the care of another person every day. We know that caregivers are likely feeling the additional stress of the pandemic. The act of caring for another person takes on added urgency. And many may feel or begin to feel being overwhelmed, a completely natural reaction. This is why I'm pleased to announce today that we are providing a $3 million grant to Caregivers Alberta to expand their services. This will allow more Alberta caregivers to benefit from things like a province-wide inventory of caregiver supports, expanded hours for the Caregiver Advisory phone line, a referral system linking caregivers with Caregivers Alberta through healthcare providers, and updated and expanded support programs. Our ability to weather this pandemic in the weeks and the months ahead depends on how well we take care of one another. And we want to ensure that caregivers across the province have the supports that they need.
We have identified 138 new cases of COVID-19 in Alberta in the last 24 hours. The vast majority are in the Calgary zone, where we have increased testing over the past several days in order to identify opportunities to limit spread, given that this zone has consistently had the highest rates of illness. I anticipate we will have more information later this week about what this increased testing is showing us. This brings the total number of cases to 1,870. Of these, 914 people have recovered. This is 37 more than yesterday. While we are seeing a steady rise in recovered cases in the province, we should also expect to see a rise of cases in the coming days as a result of expanded testing. We have completed 2,868 COVID tests in the last 24 hours. Sadly, I must report 2 additional deaths from COVID-19. This includes 1 new death at the Mackenzie Town Continuing Care Facility. There have now been 21 deaths at this facility. The other death occurred at Shepherd's Care Kensington Facility in Edmonton. To the family and friends of these people, and to all who have recently lost loved ones to any cause, I offer my deep condolences. While we can start to become numb to these numbers as time goes on, each one of these individuals had a life that mattered and people who loved them. And it is in order to prevent further losses that we are focusing measures on these high-risk areas. There have now been 214 cases, including 30 deaths, in continuing care facilities in this province. I know that many Albertans have concerns about their loved ones at these facilities. I hear their concerns and want to assure them that we are doing everything possible to help seniors and other vulnerable individuals living and working in these facilities to stay as safe as possible. It's important to remember that the COVID-19 pandemic will all be dealing with for some while. There may be certain habits brought on by our new normal, such as frequent hand washing, that should be applied for the foreseeable future. Large social gatherings are another thing that may take a while to return. We have seen from cases here in Alberta that large social gatherings carry significant risk for transmitting the virus. For those who have made plans for weddings or other large gatherings in the next few months, I would strongly encourage you to consider postponing or at least planning for smaller gatherings should the orders for mass gatherings remain in effect. I realize this is not welcome news, and I share in your frustration at the situation. Believe me when I say I wish it were within my power to give everyone back the life they had 3 months ago. Without that power, what we do have is each other, and the basic measures to prevent spread that will be with us for months to come. The most important steps we can take to prevent the spread of infection remain the same. Consistent adherence to good hygiene, such as regular hand washing, staying home whenever possible, particularly if you are feeling ill, and practicing physical distancing when you do need to go out, are the best ways to keep yourself and those around you healthy. These practices continue to be critical in the coming weeks. I would like to end by thanking the many Albertans who are caring for loved ones with health issues, including but not limited to those with COVID-19.